Oh, well, Asana, if you do have a question, go ahead as long as our doctor is okay with it. That's fine.
All right, sure. Thank you very much for giving me the opportunity. Let's say I don't know for the UK standard, but every country has their way of like describing like teenagers or adults. I think I don't know, most in Europe, like below 18, they are classified as, let's say, like teenagers or like
Yeah.
kids. But here, mostly in Europe, let's say people in their 14s, in their 15s, they are mostly into love, into relationship.
Mm-hmm.
Will you describe a kid who is, let's say, below 18, being described as a kid who has fallen so much into love that maybe like she cannot leave like a particular girl or a particular boy alone? That's not like segmentation. Will you describe it as a mental like health or as a mental disorder? Let's say no, a mental health issue.
Yeah, I think that's a good question, but I think it will be difficult to sort of give a blanket statement of what I would think without having assessed the child before. So I'm sure, Asana, as you know, that there is something called Gillick competency, and basically children under the age of 16. So in the UK, a child would be classed as anybody under the age of 16. Once they go above 16, we usually they don't fit under CAMS anymore. If they are 17 and they're already under CAMS, we keep them under CAMS, which CAMS basically is children mental health service. But if they're 16 and there's a new diagnosis, they go to adults. If they're 17 and they're already under CAMS, we keep them until 18. So we do like a little transition from 16 to 18 and then send them away to adults. So if it's a new diagnosis, 16 and under is basically children, and all will fall under pediatrics. In terms of somebody being so much in love that they want to harm themselves, so you can be in love, and nobody. I wouldn't say that I'm sort of not recognizing that emotions in the child, but anything that becomes addictive enough to, or that becomes mentally engaging enough for you to want to do something negative to yourself when that thing is no longer there, it still comes under mental health. Because the problem here is not the fact that the person is in love in quotes, but it's the fact that they want to harm themselves. That's not being in a mentally healthy place. So either way, we have to tackle the mental health. Whatever it is, we're not going to say stop loving, but we're just going to say love in a healthy way, which is the way that we're going to deal with it. Okay. I will leave the questions to the end and I'll get onto the presentation and then we'll come back to questions. I hope that was okay, Asana.
Sure,
I'll call you Asana just because that's what you want to be called today.
Sounds very familiar, Asana, your voice, but thank you for
I'll give you a question like after the presentation. So
no problem. Okay, so welcome everybody. I'm so happy to be here. It's been a while and I miss you all. I was getting a lot of messages when we were in Ghana saying that we should come back. So here we are. So welcome everybody. It's lovely to see you all. Today we're delving into something that is really close to my heart, and it's our children's mental health, specifically African children growing up in the UK. Let's be real, between cultural identity, racism, and pressure to succeed and feeling misunderstood at home, our children are carrying a lot of burden. And many times as parents, we're not sure how to help them. But we can talk about it, and that's why we're here today. So I've broken this down into segments. I think I've got 4 or 5 segments. The first one is, what does mental health look like in children? So mental health isn't just madness. A lot of the time when Africans think about mental health, they just think about, madness. A lot of people say, what we in tomorrow, and I say what tomorrow. There's a phrase that we use. But it's basically about how your child is thinking, how your child is feeling, and how your child handles stress. So are they withdrawn? Are they angry all the time? Are they struggling in school or always on the edge? It might be more than just a phase. Some people feel like, they get into puberty, hormones are up and down, and that is a real thing, but at the same time we need to differentiate between when it's just hormonal and when it's actually mental health. So these are the questions that I would ask, or signs to watch out for. Has your child had a change in appetite or a change in the way that they sleep? Have they lost interest in the things that they used to love? Now, don't get me wrong. If your child was 5 and they used to love playing with Barbie and braiding Barbie's hair, and now they're 15 and they no longer like that, that's probably a normal trajectory of how things were, except for my sister who still likes playing with Barbie. But it's probably a normal trajectory of how kids grow, and that's fine. But when I say, have they lost interest in things that they once used to love? Perhaps they used to love hanging out with their friends and they no longer do, and there are things that you can look out for. So these are things to watch out for. Sudden anger, isolation, or crying spells. or anxiety about school appearance or identity. So is a child suddenly worried about how they look, very particular about how they dress? Are they being late for school because they're spending more than, like 2 hours getting dressed, wearing makeup, things like that? So are they suddenly changing? Again, when it comes to kids, it's difficult because these could be normal traits of just a teenage life, but it could also be the signs and symptoms of mental health. So you just need to ask the questions and look out for the signs. The second segment of this is cultural conflict. So UK environment versus African upbringing. Now, I was lucky enough that I've got the two upbringing in a way that I grew up in Ghana until I was 9, and then we moved to the UK. Trying to raise a child up in the UK, but still trying to incorporate some of those African values is incredibly difficult, because many African parents want to raise their kids to be strong, obedient, and respectful. Meanwhile, British culture tells kids to express themselves and ask questions. Sometimes our children are caught between those two worlds, and it's confusing for them. So some of the common struggles to look out for are things like feeling like they can't speak at home, fear of being labeled disrespectful or being too open, experiencing racism or cultural isolation at school, and being told you're lucky, back home it's worse. A lot of the time, African parents tend to use that. If you do something at home and they'll say, "We are now Tikumha. If you were back in Ghana and cat, you wouldn't talk to me like that, or you wouldn't be acting like that." So this sort of invalidates the children's feelings. At the same time, you have to understand that they're going to school with other people from other cultural backgrounds. They're going to school with other people from other places, Eastern Europe, Americans, and the Western cultures are very, very similar. Sometimes they cannot understand why they're the only ones who, I suppose, cannot express themselves as their friends and colleagues are expressing themselves. So this can be a common struggle for them. So these are some of the things that I suppose you can talk to your children about, sit down and have a real conversation about the different cultures and how to marry the two. The third thing I want to talk about is the role of stigma. So in many African communities, talking about depression, anxiety, or even therapy is a taboo. I mean, what do you mean you're sad? Pray about it. Does that sound familiar? You're going through a really hard time, you're crying, you're telling your mum that you're feeling this way, and they're telling you, oh, let's go to church on Sunday, pray about it. There's a place for religion, don't get me wrong. As a Christian, I believe in prayer too, but there's also a realization, or we need to come to a realization that sometimes, yes, prayer is important, but we also need to back it with sort of medical input and medical support. So yes, if your child is feeling sad all the time, if you feel like they're being depressed, prayer helps, but you also need to sort medical advice. So the problems with stigma is that children then suffer in silence because they feel that anytime that they approach their parents, they're not heard. If you tell your mum that you're sad and all they've got to offer you is pray about it, then the next time you're feeling sad or feeling depressed, you don't feel like you can trust your parents with that information, because you feel like all they're going to tell you is pray about it. And you've been praying about it for a long time and nothing's been happening. The second thing about stigma is parents feel ashamed or in denial. Lots of African parents cannot go back to their family members or to their friends and say, do you know what? I've got a 16-year-old at home who is depressed. I need some help, or I need some prayers. A lot of the time, parents don't even want to talk about it, or they don't even want to accept these feelings because of the stigma that we build in African communities. The third thing I want us to think about is it delays early support, so that could change lives. So a lot of the time, before parents or African kids present to the hospital with mental health problems, then it's gotten to the point where perhaps the child has attempted to take their own life and they're actually in need of medical support. So when kids have actually cut themselves and are bleeding, or have tried to hang themselves and are actually in need of resuscitation. And I recently experienced a case where the child did not make it. The child had hanged themselves and they came into the hospital just for an autopsy. They were already dead before they got there. And that's how serious it can be if we don't start to realize that mental health is a big thing within our communities. Fourth segment I want to talk about is what can parents do? There's a lot I've talked about the signs to look out for and, the stigma that we face, but what can we do realistically as parents in the UK raising up our children, trying to marry two cultures? Just simple supportive steps. The first thing, the very, very first thing, important thing is to listen without judgment. Let them talk. Don't interrupt. Don't try to fix them. Just listen to them. If your child comes to you with a problem, don't try to. A lot of the time, I find another thing African parents do is they try to almost impose their experiences on the children, and some some of the common things were, oh, at your age, I was looking after your sister, your brother, your uncles, the chickens and the goats at home. So you should be a strong woman enough to be looking after. Just because you were strong enough to go through that experience and survived it doesn't mean that your child is going to survive it. You just need to listen to the child, and you need to really take their concerns into you need to listen to their concerns and take it into. So what I'm looking for, it's not coming to me. Anyway, second thing, be emotionally present. Check in regularly. How are you? How are things going? Once your kid has opened up to you and talked about these things, don't think that it's over or just brush it under the carpet. You need to be emotionally present. You need to check in with them. You need to ask them, how are they feeling? If your child has perhaps said something to you like, I've broken up with my boyfriend. And I had this when I was younger, actually. I've broken up with my boyfriend and I'm feeling sad. You know, you don't just brush it to the side and be like, oh, another boy will come. As factual as that might be, I remember my mom used to tell me that, you know what, boyfriends at the age of 16 are not going to last there. No, you're not even going to think about them. And it's so true. And because you've been through that experience, you know the truth of it. Like, imagine your 14-year-old telling you, I've broken up with the boy, or the boy I like me at school doesn't like, the boy I like at school doesn't like me anymore, and it's causing me mental distress. You're almost going to look at them like, 14. Really, you know, and you just ignore that, the feelings they're going through at that moment. But what you have to understand is, for them at that moment, that feeling is real. Their heart is broken and they feel like they can't move past it. So you need to be emotionally present. You need to check in with them. I mean, can't say so almost because Africans will say, oh, like, you know. This is all part of being mentally present and being emotionally present for your children. And trust me, they will thank you for it in the future. So yeah, being emotionally present, checking in with them, even if you think it's the most ridiculous thing you've ever heard, just be there for them, listen to them, and, you know, yeah, just be present. Validate their experiences. Don't compare their life to back home. UK has its own pressures. So again, you can say things like, oh, back home, kids don't even start dating until they're 18, or we didn't start dating until we're 21, and things like that. Or sometimes some parents even say, oh, I didn't have any boyfriend by your father. I only dated one guy, you know, and yes, as true as that might be, everybody's experience is different. Your experience to your mother's experience would have been very, very different. If you think about my grandparents' experience, by the age of 14, people were married. By the age of 21, they had like 7 kids. Was that your experience? Imagine if you went to your mother and you tried to talk to your mother about raising up a child, and your mother said, oh, back in the day, my grandmother had 7 children. My mom only had 2. So imagine my mom going back to say, well, she had 3. So imagine my mom going back to my grandmother to say, oh, raising up 3 children is so difficult. And my grandmother was like, I raised up 7 children. You know, it's that kind of attitude. So your experiences are very different to your child's experiences. And just because, yes, you were back in Africa and you didn't date until you were 21, and, you know, you didn't get married until that, it's a different experience. And even if you try, and I'm not encouraging that, you know, you should allow your children to date at the age of 14, 15 or 16. What I'm saying is everybody's child has a different experience, and you just need to know your child's experience, and you need to know how to guide them through that. In this day and age, children are dating at a very, very, very young age. Me, myself, it's going to be tough for raising up a child in the UK. Definitely, I think 14 is too young to have a boyfriend. But there's going to be a time where all their friends are going to have boyfriends, and they're going to have to come to you for advice. And they're going to need to be able to trust you, to be able to talk to you and say, even though, Mom, I don't have a boyfriend, I feel like all my friends have a boyfriend. What am I going to do about it? And you need to be able to listen to them and give them advice, whether it is, don't have a boyfriend, girlfriend yet because it's not going anywhere, but you need to be able to listen to them, and they need to be able to trust you before they come to you with that information. If they don't trust you, they won't come to you with that information. So that, you know, that this comes, as much as it's just we're talking about children's mental health here, but it's actually going to help the whole family, parents involved. So it's very important to validate their feelings. Educate yourself, learn about children's mental health. Go to workshops, read books, community events, talks like this, where you can learn about the signs to look out for. You can learn about the ways in which you can support your child in a better way culturally. And this is what our association is about. And I'll talk about that in a minute. But we literally built this association where we're starting it up now, where we want to be able to help parents, especially African parents, support their children with mental health. Again, it's not about me coming to tell you what to do with your child. I'm not going to come and tell you to allow your child at the age of 14 to date. That's above my pay grade. It's not my job. You're the parent. You decide what you want to do with your child, but it's just about supporting you through having those difficult conversations and in a way how to have them, as opposed to that, that kind of wild, aggressive way, which then makes the children shut off, to a way in which you can communicate with the child the same message, but which allows your child to actually open up to you and understand where you're coming from, because they feel like you've understood them. So then they can also open up to understand your perspective. And that's what we plan to help you do. I'm coming to the end of this, promise. Last 2 points: bridging the gap. Speak both love languages, discipline and emotional support. Again, I'm not going to go into this, but in terms of, you need to be able to, as a parent, you need to find a fine balance between discipline and emotional support. If you're too disciplined, your children are going to end up being more spoiled than you think. And if you're too emotionally supportive without the discipline, again, your children are going to be more spoiled. So you need to find a way to be able to balance discipline with emotional support, where you've got a good harmony. That's out with the remit of this talk, but again, this is what our society plans to do to help you balance that discipline and emotional support, where you know how you can support your child without losing that parental guide on them. And the last thing I want to talk about is, don't be afraid to seek help. Therapy does not mean failure. It means that you've tried, and it means that you care enough. I'm going to end on this note. I always say to people, when your child, when your child has a cold, or when your child is sick, you go to the GP or you go to the hospital to try and seek help for them, because you care about your child, number one, and number two, you realize that whatever disease that your child has is out with your expertise as a mother or as a parent. So if unless you're a doctor, which I self-care for my child, but if your child has a really, really high temperature, you've done everything that you've been told to do, you've given Calpol, you've given paracetamol, ibuprofen, it's not shaking, and you're really worried about your child, you will go and seek medical help. So why is it, if you feel like you're not able to emotionally support your child, or if you feel like you're not mentally able to handle your child, why is it that you don't go and seek professional support? So this is just, something I want us to think about. Being having mentally good health is just the same as having physical good health. So if you feel like there's something mentally wrong, just go and seek professional help. And that's what we're here for. That's what us doctors are here for. And it doesn't mean a failure. It just means actually you've realized that you've hit a brick wall, and that you need extra help. So on that note, I'm going to summarize. Oh, computers. Hello, can you hear me? Okay, yeah, I think you can. Yeah, so I'm going to summarize by saying raising a child between two cultures is not easy. Trust me, I'm going through it right now. And even though my child is nowhere near that age where I have to tackle these issues, I know it's coming and I'm kind of stressing about it. But even then, even now, with me trying to teach my son the Ghanaian language and the English language at the same time, everybody's got an opinion. Some people are saying don't speak Tree at home at all. Some people are saying, oh, just speak English. And everybody's going to have an opinion. But at the end of the day, you're going to need to know what is right for your child. So you have to just you have to be open, you have to have an understanding, you have to have love, and you have to understand that there is a bridge between the African culture and the UK culture, and we need to find some sort of harmony between discipline and emotional support. Don't let pride, fear, and stigma stop you from giving your child the support they need to grow up inside and outside. So I'm happy to take any questions. Well, I think it's after the break.
Yeah, I was going to say, well, before that, I really enjoyed this session. I've got a question myself, but it won't come. The question session is not yet here, but thank you, Dr. Akos, for this very lovely and educative segment or piece. Yeah, we'll go off for a quick commercial break, and when we're back, you can ask questions, any and every question, and we'll talk you through what to expect. Thank you.
Me did the young antechua, and maybe I'm discovered for Europe. I come a bushing for Ghana. No, me used to tap send, tap send. No fee mobile money transfer. Easy, convenient, fast, and sounds so free. Won't you share? Me discover ye map him. Tap send. Ain't also download the tap send app. No, ever mobile phone so free. Never see come we bushing for Ghana for na. Tap send. Papa no.
After successfully redefining Accra's skyline with the delivery of the signature apartments, Cape May Properties presents an exclusive unveiling of the tallest residential building in Ghana, offering a first look of Sultan Sky. Sultan Sky, a magnificent representation of the seamless fusion of quality, groundbreaking innovation, and pioneering architectural brilliance. An extraordinary structure set to reshape the concept of upscale living, thanks to its inventive attributes and unparalleled commitment to precision. This master-planned residential development will focus on the building's location, security, privacy, the design's aesthetic brilliance, elevated features in each living space, cutting-edge smart home technology, and amenities beyond imagination, with fantastic residential features which include 24-hour concierge service, a state-of-the-art fitness center, a floating tennis court, a floating swimming pool, a spa, a sky pool, a sky lounge, a movie theater, co-working spaces, kids zone, distinctive lifts for staff and deliveries, private gardens, chef's kitchen, expansive terraces, entertainment rooms, restaurant, and 24-hour security. Sultan Sky, a new perspective in the sky.
Hello and welcome back. And for those of you who've just joined us, Dr. Akos just took us through a segment on mental health with children, with focus on children being raised in the UK with African sort of background. Yes. And it was very lovely. Like I said, I did and really enjoy it. And now we've come to the Q&A section. So usually how it goes is we will open the floor for questioning, and you can ask questions on this particular topic or any other health question that you have. I do have a question myself, so I'll start with myself, as there haven't been any questions yet. It's actually a tricky question, the one that I have, because I was going to say, and I think you hit on it, which is the point of, I know the sayings like, Krom Hanum, I'm going to speak a bit of tree, sorry guys, say, here, yeah, so like the children are a little bit spoiled, or should I say, what's the word where you kind of almost expecting life to just be handed to you? I've forgotten what the word is. Yeah, there's a word for that.
Yeah,
Yeah, there's a word for that.
It was actually really on my tongue.
And then it's on my tongue as well. And then in Ghana as well, it's like there's a lack of. So my mom, as you know, always used to say that in Ghana, people get on with it because they're not, the support is not there. So you just have to get on. So I just wondered, how true is that? And also, how can we sort of get to a sweet place where, yes, we are supporting and helping the children. However, we are not just allowing them to just like feel like life will be handed to you, or if you cry, it's, because that's not life, or that's not how it is.
The word came to me and it's gone now. I was just still thinking about it.
I'm thinking about the word.
Entitled.
Entitled. That's the word. A lot of us seem to be entitled, or that's what it's thought.
Yeah.
Yeah.
So I think it's a very good point, and I think this is where we try to so the name of the association, or I don't even know what to call it, but the support group that we're forming is called Safe Spaces, and the whole point is that it's a safe space for both children and for parents to come and get support for mental health. So if kids are going through mental health and they feel like haven't got enough support at home, that's somewhere they can come and get support. Parents, if they feel like there's nobody they can talk to, especially nobody that they feel can understand them with a cultural understanding, and they don't know how to reach out to their child, again, it's about bridging that gap, having support for the parents. So it's not launched yet. We're going to launch it soon. I just wanted to sort of let you guys know this is something that I'm working on, and yes, it's going to come hopefully. We're thinking we might launch it on Mother's Day, which is like the Ghana Mother's Day in May. So we're working on it, but let's see how we get on. Right, back to your question. What was the question? Okay, how bridging the gap. So, how do it's difficult. Every situation is going to be different, and this is what I mean by it's almost, when it comes to mental health, there's almost personal situations, right? You can't tell what you're facing until you've sat down with your patient to know that this is what they're going through, or this is how we need to tackle the situation. So this is where it becomes difficult for mothers, because you're right. There are some people who will ride on this mental health wave and basically try to become entitled with it, And as a parent, at what point do you think actually this is not mental health, or this is mental health? And this is what I want to this is what I was reiterating on, to say that it is not your job to do that. It is a medical professional's job to do that. So your job as a parent is to listen to your child and try to be there for them. But if it gets to a point where you feel like this is too much, I feel like this child is getting out of hand, it's something that I can't do, or is there something that I'm not doing? This is where you need to seek support. And when I say support, it's not just about going to prayer groups, and it's not just about going to disciplinary camps. I was recently watching a show online, I think it was Channel 4, which covered this, and this is in South Africa, but South African parents who felt like their children were getting out of hand would then send them to this camp, which is meant to be like a disciplinary camp for like a week. And in those camps, children were ending up, they were actually some of them were becoming dehydrated, and 2 children actually lost their lives from it, because these camps are supposed to be like, oh, we're going to whip you into shape. So like, even if you're thirsty, you ask for water, that's you being entitled to asking for water, or it was something like that, and I'm just saying, these are the kind of things that I would say steer away from. Go for medical professional help. Now, it's difficult when it comes to how do we know that a child is being entitled, or are they really, really suffering from mental health? But honestly, it's not your job. You can never, ever know that as a parent. So I think that's where we come in. You get somebody who's not almost like I'm losing all my words today. When you're not involved in the situation, like a second person just standing out of it, who's not involved in the situation, like you're not a parent, you're not the child, you're just a medical professional looking at this from a medical point of view and giving a medical opinion. So yeah, I don't know if that's answered your question. I know it's difficult to do, especially it is difficult to do. Because you can never really, a neutral person. Thank you, Suzanne. Yeah, like it's just really difficult being a parent. And for example, again, I'll use my son as an example right now, right? He's gotten to that age where we call it the terrible twos. So he's going to that age where my mom says, it's a sawatiano. Like, because he's just so entitled that if he wants something, he just cries or he screams for it. And he thinks, it's going to come at his beck and call. So this is the moment where we're training him. So obviously, if he wants chocolate, and like he was actually wanting this chocolate today, and he cried and cried and cried and cried because he wants the chocolate. And I was like, I'm not going to give you that chocolate because I'm trying to instill some discipline discipline in him. So as a parent, in a way, you would know. But I mean, again, every parent knows their child as well. So if you've got into the teenage years and you feel like something's not quite right with your child and you're just a little bit worried about, I feel like there's a parental instinct that just makes you know when your child is being naughty and you know when something's off. And if you don't know, just ask for help. It's the best thing I can say, really.
No, fair point. It's very difficult, mental health. So yeah, thank you, Dr. Akos. We've got hands up. Tiama.
Good evening, everyone.
Good evening.
Thank you, Dr. Akos and Abna. I've been missing you for some time, but thank God I've met you. I'm back today. Yeah, very, very good topic. Very sensitive topic, I would say. When you talk about mental health in children, I think, was it about 2 years ago? No, about a year ago. I don't know. Sometimes I just decide to just check statistics and find out what is going on. And to my surprise, mental health in children was it's on the increase. I don't know if you've checked the ONS statistic. It's really on the increase. And I've been a parent. I sat down to say, why is this thing on the increase? And looking at going back to the COVID time, these children were used to going up and down, going to school, and then they were locked up in their rooms. My daughter was then, I think about 12? Yeah, she was 12, and it wasn't an easy time. And I had to put on my mother hat and then a hat as a health professional, specifically health visiting, because I did health visiting. And it wasn't that easy to deal with the children. Very, very difficult. But as parents, I would say as parents, we need to just be very careful. We need to be friends with their children. We should know what they are doing. We should know their friends. And we should know what is going on in their life. Don't just buy a telly and leave them in the room. Let them be part of the family. Do things together. I had quite a few episodes with my daughter that I had to sit down and say, hey, girl, you were born in Ghana. You were born and bred and battered in Ghana. Your daughter was born here. You can't impose what your experience in Ghana to your daughter. So I had to sit down. And that is one thing which we are lacking as African parents in this, where we are. Because we always want to urge you. It's very difficult. I'm just being honest. It's very, very difficult because I've come across a lot of issues, mental health issues, and parents don't want to even talk about it.
Yep.
And again, the stigma attached to mental health is very huge in this country, especially among the Blacks.
Yep.
Because we don't want to how do you call it? We don't want to talk about it. Let's push it aside. Sorry if I don't know if I should translate. Demonic. It's demonic. But sometimes you need to sit down, and then you brought these children into this country. I mean, you need to know who they are. Allow them to be who they are with parental guidance.
I think
because when you do that, you support them in everything that they're going through, and we shouldn't force them, especially when you talk about how do you call it, grammar schools. I know friends who pushed their children into grammar schools and they came out. They did very well. They went in and the competition was too much. The parents couldn't cope with it. And then, you won't believe it, one I know went into drugs and other things. Because the pressure was too much. Let's leave our children. Grammar school is not the end. Please.
You make such a good point, Auntie Amma, and I want to touch on that, but I can see that you had your hand up, so I'm gonna,
No, I think you're gonna say the same thing. This is, it's a sensitive topic, and I think Akosua and I, we weren't born here, but we were practically raised here, and we've lived here for most of our lives, and I think this topic, is very, very sensitive and very what's called eye-opening in a way to understand what I went through as a teenager. So I was a rebellious teenager to my mother. I will not lie. We clashed a lot, but now growing up, she has become like my best friend because I kind of understand her a lot better now. And I wouldn't, because from my mom's perspective, it's equally difficult for the parents. Because when I speak to her, growing up, I felt like she was imposing a culture I do not understand. Until this day, she always laughs at us because she says we don't belong in the UK, we don't belong in Ghana.
She calls us umpire. She says we're just hanging.
As a joke, that is, of course, we belong. As a joke. But there is an aspect of truth in that, in the sense that not to say we don't belong in both, but we do belong to both, which means that we are not 100%. We do not 100% understand the way the culture works. And even when we went to Ghana recently, one of a girl who's named after her, she's very witty, she's very outgoing, and she speaks what Ghanaians will say anyhow. And my mom was like, I don't like that kind of attitude because she's too
forward.
She's too petri. And I said, no, mom, she's witty. She's very intelligent. She's smart. This is what in school, in the UK, this would be appreciated. But in Ghana, it's coming off as she's petri, she's disrespectful, she speaks anyhow. And this is the culture and I think when I spoken to her about my experiences and what I went through, and on the back of also having to deal with the fact that I came from Ghana and I was bullied in school because I'm new and all these different things that we had to face. And then you come home and your parent is trying to shift you to something you don't understand. And now I've grown up and I've spoken to my mom and she said, that's what I knew. That's how I was brought up. That's how I was trained. So I was just trying to train you to be, because this is what I know, to be disciplined. So that's what my next question was also, it helps that Dr. Akosua is talking about a network that will also help the parents, because the parents also are doing what they know.
Yeah.
It makes sense.
Yeah, and I think it's really important, the driving thing that actually got me to want to set up this network, and like the way you put it, was a particular case that I had. And I'm not going to give away too much details because this is really, really recently, but she came to me, the hospital, and she had threatened to take her life. And her mother had gone upstairs and said to her, "Oh, you witch, you're always trying to, I'm a single parent, I'm trying to take care of you and your siblings. And every time that you see that I'm trying to make it," because the mother's going through her own things, trust me, by the sounds of things. And it's like, anytime that you see me trying to make it a little bit, I'm now getting ready, trying to go to work, trying to provide for you and the kids. You're now trying to stop me from going to work with this, your witchcraft. And, and the mother is like name calling this child, which then makes the child feel even more worthless, even more like she doesn't deserve to be alive because she's only causing problems for her parents. On the other side, you can look at it from the parent's point of view, where she feels as though she's a single parent and she's really struggling to look after these 3 children at home by herself. And, and then she has this really rebellious child who doesn't listen to anything, who's always attention seeking, is the way that she, and she didn't recognize or appreciate the fact that her daughter was going through mental health issues. To her, it was just attention seeking and just being disruptive. And, so there are 2 things here that we need to deal with. We need to deal with mother. Mother is going through her own mental health issues that she's failing to recognize that she's actually going through these problems. She's probably projecting that onto the child. The child is also picking up these mental health issues from the mother and then elaborating it in a way in which she understands, which is possibly UK culture. So again, this is where the Ghana and the UK thing come in. I was talking to somebody recently, and they said to me, mental health is on the rise in Africa as well and in Ghana, and that we're being influenced by the Western world and UK standards. And I always say that it's almost like autism. Is it that we're being influenced by the Western standards, or is it that we're getting more awareness of what mental health is, that we're now able to identify it a little bit more? A very, very good friend of mine, he's passed away now, but Dr. Ayiku, he was a psychiatrist and he was a Ghanaian. He was actually the consulate of Ghana in Scotland. And he said to me when I was deciding what to pick, what specialty to pick, and I said to him, I'd actually like to do psychiatry because I feel like there's so much to be done, especially in Ghana, in Africa. And he said to me that he went to Ghana for a short while when he specialized as a psychiatrist, hoping he could practice in Ghana. And he said he just couldn't practice in Ghana because, number one, back then, people didn't recognize mental health as an issue. When somebody was mad, it's because they had gone to commit murder and a form team, or they had done black magic, and then the black magic had, whenever somebody was mad and then they were on the street and they were talking to themselves, or they were naked, it was always, oh, they've committed a sin and God is now punishing them. It was never, let's take them to a psychiatric hospital. And these are the things that Africans have had to learn. But in recent times, because of social media, because of exposure, we're starting to understand that actually there is such a thing as depression. So it is not that we are now over-diagnosing mental health in Africa. It's now that we're actually learning how to diagnose mental health in Africa. And that's why the statistics are on the rise. So yeah, I mean, there are some questions in the chat as well, Sab, and I'm just going to leave that to you.
Hey, when you mentioned social media, I said perfect. There's so much you can say on this topic. It's really great. But let's answer this question, which has been here for a while, which is from John, how has the rise of social media and screen time affected children's mental health?
It's definitely affected in a negative way. You can say in some cases perhaps a positive way, but I think on the whole is a negative way. And the reason I say that is because social media only highlights the perfect life, or the life that people want to portray. Taking us out of the whole African rhetoric when it comes to children and mental health, a lot of the time when people come to the hospital with mental health in kids, it's depression and anxiety, but it's also built around body dysmorphia. And what that just means is people do not appreciate their bodies. We're seeing a lot of children with eating disorders. Why? I have a child who was she was about half my size, coming into the hospital, malnutritioned, with she was literally a walking stick, but she was still saying that she was fat and she didn't appreciate her body. She wanted to lose weight. She was on a water diet. She was not eating anything at all. She would literally, if she ate even just one crisp, she will have to make herself vomit. And, she was so underweight. She was so malnourished, but this is because she wants to be like a model. She's looking at these size 0 models online, and she's looking at them on Instagram, and she's thinking, I'm not there. We're looking at her and thinking, you're worse than that. Like, you're way past it, but she can't see it. And she can't appreciate her body. I had a family where the whole family, mother, daughter, and sister, all had eating disorders. And this is all based on the fact, don't get me wrong, again, I'm not saying that these things didn't exist before social media, but social media just really enlarges these things because you're looking at somebody's life, you're thinking they're living the perfect life. But the funny thing is, a lot of the time, you're only even seeing what they want you to see. If you look at a lot of these celebrities, even before all of this social media became a thing, celebrities always used to have these mental breakdowns and need to go to rehab because that's the kind of life they were living before that. In this really competitive life where you have to, be really skinny, be really thin, or you're not going to be picked for that movie. And females had to really live under this sort of, if you watch the next, what was it? The one that Tyra Banks did, Next American Model or Next Top Model or something. And, in these recent days, there's been so much criticism of that show. And even Tyra Banks has come out to say that, honestly speaking, it's just awareness now, because even if it were now, that show would have never aired on TV just because it was so damaging, honestly. But back then, that's what people were watching. So yes, social media is great for a lot of things. Great for a lot of things. but it's also very damaging to children. And that's why the general advice out there is that don't make children under the age of 18 be on social media. Especially, they shouldn't be on social media on, somebody help me, on
what?
parental guidance, unmonitored.
Oh, is it parental guidance?
Yeah, no, but unmonitored. You know, their activities has to be regulated. So yeah, social media is great for all things, but I definitely think that it's affected children's mental health in a negative way.
100%, even from a personal point of view for all of us. I think I've had friends, even at an adult age, come off social media. And even I've had to. Social media is great in the sense that, like, just like Dr. Akosua said, it gives information. And in an age where there's loads of podcasts, everyone has an opinion. Everyone is doing podcasts about how you should
Unchecked opinions,
how
like
you should manage your school, what you should be getting, what you should look like, what your hair should
what
look
kind of
like.
diet you should have. I mean, kids have access to all these dietary information out there. There's that intermittent fasting, there's low carbs diet, there's a keto diet, there's a water diet, and there's so many diets out there. For me, even as a medical professional, there have been times where I've seen some diets and I've thought to myself, I've questioned myself, wow, how, even as a medical professional, I just thought to myself, how would I even do this diet? And, I get confused with all the diets out there. And I've been trying to lose weight recently because I have put on some weight. And I went online to try and see, the best way. And even I was confused. The information was too much. And, and I'm thinking that's me having gone through 8 years of practically university to be a medical doctor, and I'm still confused about the dietary information out there. Imagine a 16-year-old or a 14-year-old. It's a lot of information. And another thing we forget, all this unchecked information as well. There was a point about bullying, and Abana, you mentioned being bullied when you were younger, but think about it. Back then, when you were bullied, it stopped at school. You came home and at least you had peace of mind coming to think about how to tackle your bullying for the next day.
Then you come online and it's bullying.
When you're bullied, when you leave school, it follows you on Instagram. It's in your DM, it's on your TikTok, it's on your Facebook. People are literally told online that they should go and kill themselves. That's a form of bullying. Oh, you're so ugly, go and kill yourself. People actually sent videos of how to kill yourself. We've had an episode I've had an experience of a child who came in once, and we thought, how did you even know how to use this method to kill yourself? I was like, oh, somebody sent me this video saying I should go and kill myself because I'm so ugly. And they followed the method online because YouTube is giving you, and social media, all these things are unchecked. There's so much bad information out there. Even sometimes I used to be like, people perhaps were not very successful in killing themselves because they didn't actually have the means or ways to do it. These days, you've just got to Google it. Even ChatGPT will tell you what to do. Again, not giving anybody any ideas, hopefully not. But, it's just there's just so much information out there. And it's a good thing, but like every positive thing, these are the negative bits of it. There's so much information out there. There's just free flow information, which makes it great for when you're writing a paper or when you're researching a paper. I always say when I was in university writing my dissertation, if I had access to some of the things I had here, my goodness, I would have written like 5 books by now, But we didn't have that. And it's great now for all the positive things, but it's also terrible for all the negative things. So don't leave your children monitored on social media. Please, please, please.
Dr. Akos, please, can I just say one thing? One of the things I have actually picked up from my involvement with mental health in children is again to do with the divorce rate. Is to do with the divorce rate, because I wouldn't say the ones that I've come across were, listen, I know there were a couple of married couples, but there was DV at home. When I say DV, it's domestic violence, sorry. There were domestic violence. And when children see all these things and it's not being addressed, it affects them. So I'm so happy that you are coming up with your innovation, and I think I will support you.
Thank you. Really appreciate that. Yeah.
I'm not smart, but I'm collecting the thank you on her behalf. No, this topic can go on forever, definitely, and I'm sure everyone can sort of relate, and that's what makes this so good. Any more questions for Dr. Akos? If not, we'll bring it to an end. It's been great. I feel like we should do this again, and this time we should probably do like a parents one. Well, parents as adults, right?
Yeah, I mean,
Thank you.
this was just an introduction to, what I didn't even touch on, sort of like there's so many different topics you can go into that, we can pick just depression, just anxiety, suicidal ideation. There are actually mental health diagnoses out there like schizophrenia and mania, and there's so many topics we could delve into, and I'm hoping to do a series on one of them. I'm hoping to also get some of my team members from the network to, come and talk to you about some of these mental health nurses and, very, very skilled team. So we've definitely got things in the, up the pipeline that we're hoping to bring to you. But I just wanted to sort of introduce the topic in the first place. To say that, this is really important, especially within African communities. And again, I realized that I kept talking about mothers when I was talking. But, it's just parental roles. Most of the time is because what we see our mothers, who, our mothers with children and the relationships, especially with mothers and their female children, that's the most that we see. Having said that, there are actually males and fathers' involvement, especially single parents with dads, and, how to deal with your teenage girls when they hit puberty and all the hormones are around. Again, dads, and how to be a good role model to your sons and things. So just parental guidance, really. But no, I think this is a really important topic, and like I say, it's close to my heart. So there'll definitely be more on it.
Yep, close to me. We've got 2 hands up, so we'll start with Susan, who got her hands up first, and then we'll follow with Auntie Liz.
Hey, thank you very much. This is a very laudable thing you guys have started, and I'm glad we have to talk about it tonight. I was thinking if you're allowed to do it on the Thursday platform where we have more people, on a bigger platform, because I feel it's very, very much needed. It's the awareness that needs to go out, because our upbringing obviously is a bit different from now, what is going on now. And our upbringing was usually like, there was nothing much like mental health. If you were bullied at school, maybe you were too fat, you were too skinny, just get on with it. And so now parents also don't notice those things because it's not part of their upbringing dictionary, sort of, should I say. So I also come from the point where I say a problem identified is half solved. I think there should be more focus on how to identify, because you've mentioned so many of them and their causes as well. But actually for parents and people within the community to be able to start identify these signs and to raise their hand to say, yes, we do need an intervention, or we need to start getting more involved in our children's lives where we get to the point where we feel we can't handle it anymore. We need an intervention and all that. So I think we need to stress more on those as well.
Excellent idea. I like that. Oh, we've lost Dr. Akos. Dr. Akos.
No, I'm still here. Sorry.
Okay, that was a great idea. Thank you.
Yeah.
Thank you, Susan. I think we'll speak to Nakwame backstage and see how we can. But he's probably already messaging me right Thursday. And see how we can let that happen. It would be great. It would also be great if we could actually get like maybe yourself or somebody who's brought up in your era as well to be part of it. So it'd be great to have that conversation where you have a parent-ish.
We might get Auntie Amma on, because she says she's got a mental health experience, isn't it? So
you can have like different generations.
I did quite a lot in mental health.
So you can have different generations having that conversation, I think, with a doctor involved.
Another thing I wanted to just say to Dr. Akos, our young girls.
Yeah,
I know. We tend to have issues with them more than the boys. I would just say that because of the weight issues and other things. I've got a very pretty girl, but she's constantly complaining about her weight, and she's very slim.
yeah.
And she's talking about pigmentation. She's talking about my belly's fat, and there's no belly. So I don't know if, in addition to your this thing, is it possible maybe use your social media page to organize something for these young girls to talk about all these things, because people are working in solo. If I say they are just working on their own, they've seen something, they can't talk to anybody, they can't talk to their parents about it. It's not like my children who see something and then come in and then we will talk about it, Other children are very quiet, they can't talk about it, and it's eating them inside. So I don't know if you can just come up with a page whereby these young ones, especially our colored children, African children, so that they will be able to talk.
You raise such an important point. And I think, again, it's so important because, I think even for us, we were quite lucky. And I always say this to my sister and I, because before we started going through sort of puberty and everything, my mom actually sat us down and talked about what a menstruation was, talked about what your breast is going to look like. Like she took us through all that kind of talk. And even I remember when Abena had quite bad acne, and my mom, again, she didn't do it in a very loving way, I must say, but she was, she was very much like, oh, but she would still talk to us about it. And she would say things like, it's because you're going through hormonal changes. And I mean, even though your face might be black and white right now, but look at me now, like the older you get. So we almost like we had something to look forward to, like, okay, fine, maybe we've got acne now, but once we get over this phase, and it's just having that something to look up to. But if, the teenagers, they don't know that's, and they feel like this is what they're going to look like forever. Again, to them, it can be a bit scarring for them. And even if that's what they're going to look like forever, I mean, there's beauty in everything. I think, that we just have to be able to support them, like you say. So I think it's really, really important. And I'll take that. I'll take that on. Actually, that might be a good session to do with the network for teenagers. And
one thing I just want to add before Auntie Liz, so sorry, we'll come to you next. Just to add, and I always said this, that growing up, I've realized, and I think Mom also mentioned something. I was talking to her about something, and she said, honestly, it was lack of knowledge, and she herself didn't know. I think a lot of the times it's almost like we leave, it's going to go. And I've always said the one thing I'm going to do for my daughter is to ensure that she has the medical help.
Input earlier rather than later.
Because there is help for all of these things. There are help for all these things that they're going through. And sometimes we are, and not, again, I'm not blaming any parent, no fault of their own, because through my mom, I do know that a lot of the times it's because we don't know, or there's lack of knowledge on it, which is why Dr. Akos make the point of, in today's world, if you don't know, seek that help, ask as many times as you need to, just always go back, just ask, look around, search it. And so I think if you can also...
We're lucky here in the UK as well, that healthcare is free in a way, especially for kids. Kids never have to pay for their medication. So if your child is struggling with acne and pimples and things like that, they go to the GP. Don't get me wrong, I know some GPs are not the best, and you might be in a waiting queue for 2 years, but at least if you're getting the creams you need, the medications that you need, at least it's a starting point. But again, we can talk about all that. I think that's a good idea. I like that idea, actually. So I might do a session for teenage girls, but obviously not on here, because they probably won't come and watch it here. So
no, please, they won't come here.
I know, so we'll have to find a way to draw them in. Yeah, absolutely.
TikTok in particular. Auntie Liz.
The America ni semi the any question o me mama kwaba. You didn't man cry that, but said your voice no.
Oh, yeah, cry you.
Yeah, to be honest, I don't think so.
Cry. The very last show with I think you were not there.
I had an exam on the Friday. So you're very sorry.
But I mentioned that we're going to Ghana, so we're not going to be here for I did mention it on the last show that I did.
Okay. I'm sorry then if you did, but
Dr. Akos,
hey, Auntie Amma,
after the show, let's talk about this after the show.
Why are you? Anyway, and where's Dr. Kojo today?
Oh, Auntie Liz, he's working and he's actually sends his regards, but hopefully you will see him soon. But today he's had to pick up a shift.
Where the
Oh, say you family a check. Let's see your family there.
In a family, the way you're saying your mom was there, your dad must be there, and everybody.
No, that
It
didn't
was a
go.
special occasion.
That was those, but that didn't go actually.
It was actually my cousin's wedding in Kumasi. So we went to Kumasi for my cousin's wedding.
And then you did the traditional of somebody's as well.
No.
Yes.
Absolutely not. No. It's not happened.
Somebody said yes. Auntie Amma, was it you?
It's not happened.
Yes, it's me.
Were you there?
How can we?
Don't worry, you will all be invited.
Exactly. How can we do it without telling you? It's not possible. Let's bring the show to a conclusion.
From our conclusion. Said the Muhesi acquire fedo. Yeah, they rather says what the Maba. But I also cried there near man.
It has really apologies. Let's apologize again. Me personally, dear, now me exam Friday, Wednesday.
Yes, the last one was Dr. Koska said you were doing something to one hostie and the doctor 1 man 1,000, 1 woman 1,000.
That's it.
Oh yeah, in the baby.
Well done.
And was that day that you said we'll cry?
It was that day. I said it right at the end, so maybe we missed it. But yeah.
Okay.
Oh, Auntie Susan, please, I haven't done anything, but I don't even know what I'm being congratulated.
Now you are blushing, oh.
But no, nothing. Just went on holiday.
Wow.
But yeah, thank you very much, guys. We are back.
We've missed you, though. Yeah, the radio is so much.
Missed you too. I'm so glad to be back. So yeah, we look forward to.
Well, now Kwame did well by hosting and so we thank God everything went on well. We didn't close for a week. We ran throughout.
Yeah, that's lovely. Thank you.
We were very happy to see that there was continuation. So thank you all for still engaging with the show and still being here. Honestly, we love you guys so much because without you, there's no show. So no, thank you so much.
Quick one, please, Dr. Kuz, what's your TikTok handle?
It's Dr. Akos. So it's Dr_Akos.
All right, guys.
I think let me put the details on the.
Please do so. Thank you.
Social media.
I'd wanted to ask, so is this going to be different from Oasis? Because I already follow you on Oasis on on Instagram.
No, Oasis is the only handle I have on Instagram. I don't have any other handle. So if anything I'll do on Instagram will be on Oasis.
Oh, okay. All right.
So when it comes to TikTok, when it comes to TikTok, because she's the doctor, she's got her own, she does her, what's it called? Doctor words or doctor whatever's on
1 minute
on Instagram. We are together as a unit, because we also host stuff as well. So you'd see a lot of anything that we are involved in coming on our Instagram.
Okay. All right. Cool.
But for anything typically medical, which obviously, as you know, I am not involved, it will be on the TikTok.
Dr. Abna went to medical school near somewhere.
I mean, I have medical knowledge, but it's on your friend said, what's it called? On class? Is it on what's it called? What's the word? Unofficial medical knowledge.
Honorary medical
honorary, yeah.
Sorry.
Which most Ghanaians have, so you are allowed to have one. Yeah.
Exactly.
I've put all the links in the chat. So if you want to follow our social media handles, our Instagram, TikTok, and then our email, if you've got any questions or any medical questions you'd like us to answer, it's all confidential. It all comes to me. So don't worry. And it's all anonymous as well.
Yes. Exactly. And we in the past, we've brought up a few doctors here and there. So for those that know those doctors who have specialist interest or are specialists in certain areas, if you do want to speak to a particular doctor about a specialist area as well, again, just let us know and we can signpost you to that particular doctor. And Dr. Akos,
Dr. Mustafa, when is Dr. Mustafa coming?
Oh, he's a very busy man, but we are trying best to get him. And by the way, Asana is Dr. Blessing. For those who know. Yes. So, so Dr. Blessing is here. Thank you for joining. So we will try and gather all these doctors who joined, who have been supportive of our show in the past, at some point. So they'll all come up soon.
Dr. Mustafa is running away from the
He's just a very busy man, but we will.
Antiama, it's your fault. that Dr. Mustafa is not here. Dr. Blessing, I want him to come, but I don't want all the doctors to come together with Dr. Blessing. Otherwise, the GP fight will start again.
So Dr. Blessing, you are here live and colored. We will talk backstage and we'll arrange something for Dr. Blessing to come and also speak on his ability. Yes.
Yes.
Dr. Kos, please, can I ask you one medical this thing? If you've got an advice, just this thing. How do you reduce inflammation? Or when once CRP is raised and then ESR is raised, how do you deal with it?
So remember, not all inflammations are bad. So be careful what you want to reduce. Doctor, continue.
So CRP and ESR is very specific, and usually in the hospital, how we would reduce that is we would treat whatever's causing the ESR or CRP. CRP.
Please break CRP, ESR for those.
I can't really break it down. It's just an inflammatory marker. So when you go to the hospital, CRP is I don't even know what it stands for, something protein, and then ESR is also something sediment rate. So it's they've all got like long names, but they're basically inflammatory markers. It just tells you when you've got inflammation going on. Most of the time, CRP is a marker for things like infection. ESR is a marker for things like, again, it can be infection, but it's mostly things like arthritis, like rheumatoid arthritis, like autoimmune conditions, things like that. So depending on what the cause is, usually in the hospital, we will try and sort out the cause for that. In terms of how to bring down inflammation, just generally, eating lots of fruit and vegetables. Now, I say this because if you think about inflammation, usually it's caused by oxidative stress in the body. So antioxidants, you want to eat things that contain antioxidants, which are mainly in your fruits and your vegetables, mainly your greeny, leafy things. So that's the way to bring down inflammation in the body. But CRP and ESR specific, you have to actually tackle the specific cause. CRP is really general because CRP is raised with the littlest thing. CRP is raised when you have a fracture, when you have an infection, anything that causes your body to say, I don't like this situation, causes a rise in CRP. So it's not really a specific marker for anything, but it's usually raised when anything in the body is wrong. So again, antioxidants will be a good place to start.
Okay. Another thing I was just told, or I heard, that among the Black and Caribbeans, some have got high ESR, and it's normal for them. Is that right? And especially, I was told it's in women.
It can be. Again, the exact reason for that, I don't know. It's the same way that we talk about how and again, actually, I don't want to commit myself with this because I'm not entirely sure. But no, you're right. There are some cases where especially within the Black community, ESR is known to be. But again, when we talk about raised ESR, so there are usually ranges where we get worried. Now, having a little raised ESR, like for example, again, even a CRP, if your CRP is something like 20, as much as it is raised, I'm not worried about a CRP of 20. When you hit a CRP of 100, I'm starting to worry about it a little bit more. It's the same with the ESR. So depending on how raised your ESR is, I'm not too concerned, especially...
67.
How much, sorry?
67.
Yeah, again, it's still within the double digits. I'm not too concerned about that. Again, it depends. So for example, I always say there's something that we're always taught, treat the patient, not the numbers. So if you have a raised ESR of 67, but you have nothing wrong with you, I have no reason to treat that ESR as causing you no problems. But if you came to me and you said, doctor, I've got really bad knee pain, I've got a really bad hip pain, and your ESR is 67, then I'm going to investigate a little bit further. I'm not going to do anything particularly about the ESR, but it just tells me that actually that hip pain or that knee pain, I need further investigation because your ESR is raised as well. So again, it's not just about the numbers, but it's about the full medical picture.
Thank you, Dr. Akos.
No problem.
Excellent, great stuff. As always, we are always over time because we enjoy these shows, and I love listening and getting involved. And today was a particularly good one. So for those who joined a bit later, today we talked about mental health in children. Dr. Akos introduced us to the segment. There will be further segments on it. There's a lot that we can unpack on this topic, and as you know, an hour never does it justice. So Thank you, Dr. Akos, for imparting your knowledge. Thank you for everyone who contributed with questions, any personal experiences, and thank you to everybody who is here, who has been a part of this from day one. I also would like a massive thank you to Nana Kwame for keeping the show going on when we were away for almost a month, or I think about a month, and he's been hosting and making sure that the show goes on. So thank you very much to Nana Kwame and thank you TAPTAP Send for sponsoring the show as per usual. So tomorrow, a time with TAPTAP Send, same time, 8 o'clock. And on Friday is Ask the Lawyer. Please do not miss any of these. Thank you very much and see you next week. Have a good night.
Bye.
Good night.
Good
Thank
night,
you.
all, and welcome back, girls.
Thank you.
My chef and party planner. You know we can't get this retirement/birthday shindig go wrong.
Everything is almost ready, but small problem.
What's up?
We are way over budget, Kweku. Everything is almost twice the estimate.
Alibaba, okay? No worries.
So with TAPTAP Send, I have got a cake and decorations covered for the year.
You handle the food.
If any extra expenses comes up, just text me or call me.
I'm off today, so I should be easily reachable.
Hey, chairman, it is for there.
Say, no be easy, you. Chairman has time and money.
Allah,
Kweku tap, Kweku do, Kweku that.
our chairman can't follow.
Hey, Alande, Chairman send them.
TAPTAP Send. Papa no.
After successfully redefining Accra's skyline with the delivery of the signature apartment, Cape May Properties presents an exclusive unveiling of the tallest residential building in Ghana, offering a first look of Sultan Sky. Sultan Sky, a magnificent representation of the seamless fusion of quality, groundbreaking innovation, and pioneering architectural brilliance. An extraordinary structure set to reshape the concept of upscale living, thanks to its inventive attributes and unparalleled commitment to precision. This master-planned residential development will focus on the building's location, security, privacy, the design's aesthetic brilliance, elevated features in each living space, cutting-edge smart home technology, and amenities beyond imagination, with fantastic residential features which include 24-hour concierge service, a state-of-the-art fitness center, a floating tennis court, a floating swimming pool, a spa, a sky pool, a sky lounge, a movie theater, co-working spaces, kids zone, distinctive lifts for staff and deliveries, private gardens, chef's kitchen, expansive terraces, entertainment rooms, restaurant, and 24-hour security. Sultan Sky, a new perspective in the sky.